Welcome back for those of you who have joined us from yesterday, and welcome to those people who are new today, didn't make it yesterday. Hopefully you saw I uploaded the video of yesterday's recording into Milo by YouTube, so hopefully you can have a look at that in your own time. I've also uploaded the PowerPoint and the answers, you can have a look at that in your own time, test yourselves, and then go and check how you got on. Now, as we start, and I see everyone still joining, so we'll take a sort of slow lead into our session. I did have, I was contacted this morning by someone who was in the session yesterday and who felt perhaps some of the behavior in the chat was maybe not always appropriate. So we might just ask that, remembering that we're on a university system, we're not out on YouTube and open to the world, that we do try to remain relatively professional. And I've actually asked Dr. James Crane to come along and act as a moderator, because I can't always obviously look at the chat. James has just said hello. So please, I want everyone to contribute, and maybe if there's some negativity felt in the chat room, then maybe not everyone will feel like contributing. So that's the reason why we sort of asked James to come along and just moderate things. So if you are here to play around, maybe just watch the recording at another time, but hopefully everyone's here to participate, learn something. We can have some fun and just be encouraging at the same time. Yeah, okay, so again, like yesterday, I've added actually a few more questions than I originally had, so it probably won't take the full hour and a half, but you know, it does give you an opportunity to ask questions along the way. And now we've got two brains here rather than just one, so James can help out in the chat too. So yeah, if we, thanks Emily. Yeah, we'll just try to keep it nice, and if you find yourself booted, then you've been a naughty person, and James has booted you from the session. So yeah, and we've decided to allow the name "Your Vagina is a Tomato" just because I made reference to it in the lecture. Otherwise, we know that may not be allowed in normal chat circles. But yeah, I did make a mention of it along the way. So yeah, all right. Does anyone have any questions before we begin? Just so you know, we're recording, so stuff you do say in chat is actually recorded as well. It's not evident on the YouTube video that I recorded, but it is available if you can find it through the Collaborate tool. So if there aren't any questions, then I'm happy to proceed with completing our look at the urinary system and then moving on to the reproductive systems, and again doing a mix between PowerPoint based and Kahoot based. All right, so let's move forward. So this is where we sort of finished off yesterday. We had a really brief look at the histology of the renal cortex. We saw that it's made up of these arrays of medullary rays, and then we've got the cortical labyrinths in between, and the medullary rays contain the collecting ducts and the loops of Henle, and the cortical labyrinths contain the renal corpuscles, the proximal distal convoluted tubules, and their various blood vessels in those regions as well. So this is a very short question here, so there's only two things to identify. So see if you can sort of work out where this section's been taken from and what the features are that I've labelled here A and B. And when you think you know, how about, rather than a 1 in the chat, we actually get a thumbs up in the chat, so I know everyone's ready.
A few moments later.
Great. Well, that's a lot of thumbs up, so I think we are ready to progress. So I suppose the first question, other than, identify A and B, is where do you think this section's been taken from? Obviously, I think it's pretty obvious that it's the kidney, but whereabouts in the kidney do you reckon this section's from? Medulla? Cortical labyrinth? Cortex? Well, actually, it's sort of both correct. Yes, Callum, that's right. It's actually sort of the junction between the cortex up here, because obviously we've got renal corpuscles, and renal corpuscles exist within the cortex. And then down here, we've actually got the medulla. You can actually see a little collecting duct there. It's a little bit out of focus. Here on the left, but these are collecting ducts. And then we've got the loops of Henle here, so sort of the thick limbs here. So if we think about this then as the junction between the cortex on the top here and then the medulla on the right, what do we think A is? Gosh, you don't need me at all. You guys know all the answers. This is really great. Yeah, so it's a arcuate arteriole. I think it's actually probably a continuation of this vessel here, and this is quite clearly a small artery. You can see the internal elastic lamina here, so you've got that waviness, which is really typical of a muscular artery. And so there's a smooth muscle around the outside there. So these are probably the very thin walled veins, and then we've got the artery here, and of course the larger blood vessels at the junction between the cortex and the medulla are the arcuate vessels. And then what about B? Sorry, we've got a question here before we move on to B. Can you use RBCs and the lumen to differentiate arteries and veins? You can sometimes, but not always. So I would identify this on the right-hand side as a vein, mainly because it doesn't have much smooth muscle in its wall, and it does have a lot of red blood cells. But the fact that this has this waviness should almost immediately lead you to think it's a muscular artery. And that's because of the internal elastic lamina, which is really prominent, which causes this sort of waviness that we see here. So very classic of a muscular artery. Now, it's not as evident here, but I think it is present here. So arcuate vessel is I think completely an appropriate answer for this vessel over here. So we have, how do you differentiate between corticomedullary junction and a cortical labyrinth medullary ray junction? The medullary rays are always best identified in longitudinal section, and I would only ever sort of present you with a longitudinal section of a medullary ray. I'm certainly not in the business of trying to trip you up. We want very clear, easily to identify things. It's certainly not my job, and doesn't work in my favor to give you something which is going to be super tricky to identify. It's going to be nice, clear cut, like I've presented in the lectures. So they appear as bands, like we saw in that previous. So they appear as these sort of bands of longitudinal arrays here, these medullary rays. And so this obviously is quite a magnified area, difficult to see a medullary ray in this micrograph here. B then, what do we think B is? Bowman space, urinary space? Yeah, this arrow's not quite pointing to that though. Glomerulus. Okay, the arrow's pointing to the capillary loops. So by writing glomerulus, you're probably half right. What's the full answer? What's a more complete answer? Yeah, renal corpuscle. That's right. So because it's not specifically pointing, so this arrow here is definitely pointing at the capillary loop, but this one's actually pointing to the urinary or the Bowman space. So here we're actually referring to the whole structure. So that's the renal corpuscle, which of course is the glomerulus and the Bowman's capsule, which includes both the parietal layer and then the visceral layer of Bowman's capsule, which is the podocytes. So peritubular capillaries are on the outside between the these proximal and distal convoluted tubules. Obviously a bit difficult to see at this magnification. All right, does anyone have any questions before we move on then? No, good, okay. So here we've got another H&E stain section with a number of questions. So I'll give you a few minutes. And once again, when you're ready to go, how about you give us a thumbs up in the chat?
A few moments later.
Okay, lots of thumbs up. So I think we're about ready to go. So what do we think the tissue labeled A is? Oh, what's the matter? Good morning. Sad face. Emily's given us a complete answer. Yep. Yes. Everyone's correct so far. Yeah. So the tissue is transitional epithelium. So transitional epithelium is a stratified type of epithelium. The surface cells often appear domed in a relaxed form. They're known as umbrella cells, but they can expand upon stretch. And so that's actually one of the features that's unique about transitional epithelium, that it can appear stratified like this, or when it's actually expanded, like when you get an increase in volume of the urinary bladder, for example, it can almost appear as a simple epithelium. And these cells are actually able to have internal folds within them, which enables them to stretch. And they also have lots of tight junctions between them, which actually forms a waterproof seal. So yeah, everyone was correct with that. All right, what about tissue B? This is a bit trickier, this one. Maybe not so tricky. Yeah, so it's the inner longitudinal layer of smooth muscle. So if we've got a transverse section, which we do here, then these cells have been cut in cross section, because we can see that how round their nuclei are, whereas this is longitudinal. So it's like the smooth muscle is coming out of the screen towards us. So that means it's running the length of the ureter here. So this is an inner longitudinal layer of smooth muscle. And that's unique to the urinary system. And we also saw it, who remembers where else we saw this inner longitudinal, middle circular, outer longitudinal arrangement? Yes, well done, LeBron and Julia, that's right. Ductus deferens is the site where we saw that as well. Identify the tissue labeled C. Yeah, good. Oh, you guys are killing it. Yeah, absolutely. So that's the lamina propria, the loose connective tissue that sits beneath. It looks quite dense, doesn't it? It tends to be a very cellular, primitive type of connective tissue for some reason. I'm not 100% sure why, but it doesn't have those nice ground substance spaces like we normally see. So it's quite cellular type of tissue. All right, identify the tissue labeled D. Yeah, so that's exactly right. It's actually, in this case, because well, we're sort of leading on to the next question. It is a circular layer of smooth muscle. So I suppose that then leads us into the next question, because I don't want to sort of jump ahead, but is this a more proximal or distal section, and how can you tell? Oh, Claire's already jumped with the answer, and she's absolutely correct. So it's a more proximal section because there's no real outer longitudinal section of smooth muscle yet. So it gains that third layer of smooth muscle as it moves closer and closer to the urinary bladder, which is more distal. So it is correct to call this middle circular layer, although it's not middle yet, it's really outer. So we have an inner longitudinal and then this middle circular layer, and then eventually it'll gain a third outer longitudinal layer. I'm not sure you can. This is connective tissue. You see how it's the same sort of color as the loose connective tissue, the lamina propria. NC, you can see some blood vessels out here. So I think this is part of the adventitia or the serosa on the outside. What about the bottom of the section? Again, I think this is connective tissue. We might be able to see just a little bit of evidence maybe of some cross sections here, but it's not a proper band that we'd see in the distal part. So it's quite close. So Emily's asked, would some skeletal muscle appear at some point distally for voluntary control? Is that another reason this is a proximal section, or is that totally different? Yeah, so there's no skeletal muscle in the ureter. So the skeletal muscles involved with the external urethral sphincter, which is in the urogenital diaphragm. So there's no sort of skeletal muscle control over the movement of the urine through the ureter. It's just a sort of a peristaltic control. Good. All right. Does anyone have any other questions? And see, so you were right. There is very small amounts. So we're sort of probably coming closer to the distal part here, but I would probably identify this as a little bit more proximal. Highly folded. It's a little bit folded. We obviously don't see the whole thing. I think if we do see the whole thing, we do have this sort of star-shaped appearance to the lumen, which is very typical of an organ which has a well-developed muscularis layer. Okay. All right, so we're going to move to Kahoot now. So we'll do this. So I've created a new version of this. So we're not sort of continuing on from yesterday. We're starting, I've added a few new questions as well. So the whole one I started with yesterday had 16, but this one's got 10, so I've added a few new questions. All right. So have your mobile devices ready. Wait for it to load. Okay, classic. Welcome, Seb. Everyone's popping in and out. AS number 2. So there's the pin, 4351732. And I just typed that in the chat just in case someone asks a little bit later. Everyone was really great about sharing that around for the people who weren't here at the start. So. I'm sorry you're in great pain. That sucks. So we've got 60 at the moment. It's pancreas time. James Crane 2 has joined. James is laughing. We're in the same office together. He's just... All right, it looks like everyone. Oh, we've got more people playing because we've probably got people who's working in groups here. Because interestingly, obviously, I'm trying to work out, how popular these things are. And so, how many people? Good morning. How many people in with you? 5. Cool. 2. Right. Oh, that's really interesting. Thank you for everyone who's responding. 10. There are really 10 of you. My 2-year-old is helping. Wow, that's great. No, 3. Great. Oh, it's good. I'm happy that you're all working together. I mean, that's really fantastic. All right, so I'll give you another few seconds to join if you haven't already. So Claire's asked, going back, will you ever ask us to ID specific parts of the renal corpuscle with an arrow compared to questions asking if the components which make it obvious where you're asking? Yeah, like I said, I never really want to trip you up, so it's gonna be very specific. I don't think in the last few years I've ever sort of pointed to a component. It'll be very, very clear if I've asked you to identify the subcomponents of the renal corpuscle. Yeah. All right, so let's get started with the Kahoot then. So there's 5 questions on the urinary system here. Which of the following forms the filtration slits in the glomerular filtration membrane? Good. So overall, the answer was answered correctly. So the filtration slits, the sort of second to last sort of barrier, I suppose, of the glomerular filtration membrane. So if we start from the inside to of the capillary to the urinary space, it starts off, of course, with the fenestrate of the fenestrated capillaries. Then we have the fused basal lamina, which half of which comes from the glomerulus endothelium, and half of which comes from the podocytes. And then we have the spaces in between the pedicels, which are known as the filtration slits. So that's the visceral layer of Bowman's capsule. So podocytes, of course, the other name for the visceral layer of Bowman's capsule. And then they have little membranes across them. So we actually have filtration slit membranes, which also are part of the glomerular filtration membrane. So Ligi, however you say that, is in front. Now, B has raised their hand. Did you have a question, B? Did you want to type it in the chat before we move on to the next question? Oh, no worries. No worries. We can move on then. All right, next question. Which blood vessels are characteristically found at the kidney's corticomedullary junction? Well, we just discussed this, so yeah, so we just discussed that. So at the corticomedullary junction, we find those large arcuate vessels before they branch in to form the interlobular or the cortical radiate blood vessels like we talked about yesterday. So Wubba Lubba Dub Dub has asked, filtration membrane is the diaphragm, right? So I'm not quite sure what that question is asking. So if we think about the glomerular filtration barrier or the glomerular filtration membrane, we're talking about all of those components. But when I talk about the diaphragm, what I'm talking about is there's a little extension of the cell membrane between the pedicels or the filtration slits of the pedicels, and that actually has a little charge, and it's actually a component that, you know, everything that sort of filters through actually has to get past. Does that answer your question? Right. No worries. Okay. So Luigi's still in front. Next question. Which of the following secretes renin? Good. Very overwhelming correct answer there. So yeah, juxtaglomerular cells, which are actually modified smooth muscle cells of the afferent arteriole. So that was a bit of a tricky one there. Juxtaglomerular cells are those modified smooth muscle cells of the afferent arteriole, and they secrete renin in response to a decrease in stretch. Macula densa, of course, are the osmoreceptors. So they're detecting the levels of sodium in the filtrate. And Lacer cells, of course, are also known as extraglomerular mesangial cells, and they're found outside the glomerulus, and they're thought to act as sort of an intermediary between the macula densa and the juxtaglomerular cells. So well done. Who remembers what renin does? Silence in the chat. Converts angiotensinogen to angiotensin. Yeah, that's right. So it converts angiotensinogen, which is already in the bloodstream, into angiotensin 1. And then what happens to angiotensin 1? Yeah, renin, angiotensin, aldosterone system, NC. ACE from lungs turns it into AT2, and then AT2, you guys have got this down. I don't even know why you're here. You know it all. What does AT2 do? Vasoconstriction, yep, good. We need this last part of the RAAS, aldosterone release. Yeah, that's right. And then aldosterone stimulates the distal tubules to increase sodium reabsorption, potassium secretion, and because we're absorbing more sodium, the concentration of water is higher, and therefore it moves down an osmotic gradient, and so water follows, and we increase volume of blood, thereby increasing the blood pressure. Yeah, great, well done. I think I mentioned this in the lecture. I really enjoy this system because it's quite a logical system. It's really good. All right, Smallsy's taken over from Monica. All right, question 4. The macula densa is formed by which part of the uriniferous tubule? Yep, well done everyone again. Guys are killing it this afternoon. Distal convoluted tubule. So every distal convoluted tubule comes back, makes contact with its renal corpuscle in between the afferent and efferent arterioles and forms the macula densa. It appears different because the normal distal convoluted tubule is quite a short cuboidal type of epithelium, but the macula densa actually is almost like a columnar accumulation of dense nuclei close together. So well done. My name Jeff, not happy. Didn't get that one. Did you think something else? My name Jeff. Oh, fat fingers, okay. I know what you're talking about. All right, Smallsy still in front. Shout out to Smallsy, as someone said before. LeBron. All right, this is the last question for this round. The real James Crane is going to kick you. Which part of the urethra has been shown in this video? So once again, there's no audio to this video. And of course, the timer starts once the video finishes. So the video is only 52 seconds long. Good, yeah. So that's the male prostatic urethra. So if we have a look again, so I'll just pause it here. So this is the urethra here, and then these are all the prostatic glands. So if you remember, we have the sort of idea of the urethral crest, and we've got the mucosal glands emptying into the urethral crest and some of the submucosal glands, and then the sinuses here, they collect all the secretions from the main prostatic glands, which are found out here. So these are the main prostatic glands. Good, well done. All right, so that's with Luke in front. Thanks, Connor. We'll move back to our PowerPoint. So, I'll move this up a bit so you can hopefully see it. All right, so there's lots of questions here. This is obviously a section of the ovary. So give you a few minutes to answer that. Once again, let me just quickly H for some reason. Should be there. All right, we'll give you a few minutes, and when you're done, please. I suppose, Emily, it is a distinguishing feature. It's not really sort of C-shaped in the penile urethra. Yeah, when you're done answering the questions, give us a thumbs up in the chat and we'll talk about the answers.
A few moments later.
Okay, that looks like lots of thumbs up, one thumb down. So the antrum labelled A here belongs to what type of follicle? Graphian, Graphian, Graphian. A giraffe follicle. So now I'm not sure I would actually classify this as a Graphian just because of its size. A Graphian follicle I would expect to have a much larger follicular antrum. Obviously, it's difficult to put into context, but you know, sort of in comparison to the structures around, it's not a super large follicle, which is what we expect of a pre-ovulatory follicle or a Graphian follicle. So I would more likely say a secondary and or a larger antral follicle, but not a pre-ovulatory follicle or a Graphian follicle. That would be my interpretation. Obviously, if this was a slide, obviously you'd get a better idea about size comparison. Sorry, guys. Identify the specific layer labeled B. Zona Granulosa. Corona radiata. I see some question marks there. Yeah, that's the corona radiata. So the other feature which sort of makes me think it's not a Graafian is that as it becomes a Graafian, what happens is you end up with a little stalk of cells that then leads to the corona radiata. Remember the structure called the cumulus oophorus? It's a bit of a weird name, but it's a little stalk that connects the wall of the follicle to the corona radiata cells. So these are the corona radiata cells. Using specific terminology, identify C and its chromosomal complement. Now here, chromosomal complement means it's, is it haploid, is it diploid? And C, yes, that's exactly right. It's a diploid primary oocyte. So what phase of meiosis is it at? Yeah, that's right. Well done, everyone. Prophase 1. So it's a primary oocyte arrested at prophase 1, and it's a diploid cell. Good. The cells within D predominantly have receptors for which hormone? Hi, Hamish. Welcome. Oh, doubling up. Only gets half a mark. So it's actually FSH. These are granulosa cells. So before, who was it? Let me scroll back a bit. NC, you mentioned the zona granulosa. This is the zona granulosa. So the zona granulosa is the follicle wall made up of granulosa cells, and these cells have the receptors for FSH. And their role, what's their role then? If they bind FSH, what's one of the roles of the granulosa cells? Maturation? Yeah, so it's actually partly responsible for maturing the oocyte. Yeah, that's right. My name's Jeff. It converts an androgen into estradiol. So the presence of FSH stimulates the enzyme aromatase, which converts the androgen into an estrogen. That's why as this follicle gets bigger and bigger, the levels of estrogen also rise in a normal ovarian cycle. E now, identify the structure feature labeled E. I think I've scared everyone away from volunteering answers. Clue? Yeah, so that's that little structure here. This little structure here is referred to as a zona ghost. Do you remember where we find zona ghosts sometimes? There's been a few right answers. It's an atretic follicle. So this session is recorded, anterior mesenteric nerve. It's currently being recorded. So if you do have to head off, that's fine. You can access it later. Yeah, so this is an atretic follicle. This is a follicle which was developing but has now actually undergone atresia. And so this is the sort of remnant of the zona pellucida which existed around the oocyte. And then all of this is sort of the involuting follicle tissue, which is sort of involuting there. And of course, we know that atresia is a major component of and responsible for the numbers of deaths of follicles throughout a woman's lifetime, and so therefore it's a very prominent feature of the ovaries. F, identify the follicle identified as F. What was E? Identify the structure labeled E. E is an atretic follicle. Primary unilaminar follicle. Yep. Primary follicle. Yep. Unilaminar primary. You may just be starting to see the the multilaminar. You can just see nuclei just a little bit at 2 levels, but it's predominantly a unilaminar primary follicle. So all of those answers are going to be correct. I wouldn't differentiate between those two there. So you can see nice big oocyte here, and then one, and then maybe starting to get 2 layers of granulosa cells. So then the basement membrane would sit on the outside. Identify, whoa, what happened then? Identify the follicle identified as G down here. Yep. Great. So those are primordial follicles, and so they're the store of follicles within a girl's and a woman's ovaries. So then approximately how many of G are present at birth, and then how many are present at puberty? Do you remember that graph, and how many are present at birth and how many are present at puberty? 2 million at birth? Exactly right, Tom. Well done. 2 million? Great. And then 200 to 400,000 at puberty. That's right. Great, G Hill. Yeah, real slim shady. There's about 300,000 left at puberty. That's right. So we've undergo this process of atresia from birth till puberty, because until puberty, there's no cyclic recruitment. There's always this internal recruitment of these primordial follicles to become the primary follicles, but then without FSH, they only get to the small antral stage. Without FSH, there's nothing to capture them to cause them to become larger antral follicles. And so they undergo atresia. And so start off with 2 million, it declines to about 300 to 400,000 by puberty, and then there's an exhaustion over the woman's lifetime. What I was going to say, I was going to ask you then, how many oocytes typically does a male woman ovulate in her lifetime? Yeah, Julia, that's right. Yeah, somewhere between 400 to 500 about. So NC, yeah, that's within the range. So that's exactly right. Yeah, well done. So you produce so many and then only ovulate 400 to 500. All right. All right, so we're going to go back to Kahoot. I'll do a couple of questions here. So I'll just give you a couple of minutes to get your devices ready in case they weren't ready. All right, so I assume everyone's ready. So next question. Which phase of the menstrual cycle is represented on this slide? So again, it's a short video, about 36 seconds long, and then the timer will start. Ooh, okay. So that one obviously was a bit of a tricky one. So the majority of people have said proliferative. A couple of people have said ovulation, and 15 have said secretory. So menstrual cycle consists of menses, proliferative and secretory phases. And if we have a look at the video again, what are some of the features to look at? Well, one big thing which you can see even at this magnification is that the epithelial lining has come away from the tissue here. There's no surface epithelium, and we've got lots of blood on the surface, so the tissue is very disrupted, which is typical of a stratum functionalis, which is actually undergoing ischemia. So this is actually a menses phase of the menstrual cycle. The glands are breaking down, the surface tissue, the stroma is breaking down, and we can see a large amount of blood being released at the same time. So that's why that was menses. And that slide is on the digital slide box. So if you need to go back, there's a slide of the menstrual phase, there's a slide of the proliferative, and there's a slide of the secretory, and I use those pictures from those or slides of those in applied exams and ask you to identify, which phase of the menstrual cycle. You can't access the digital slide box. Have you tried creating a VPN first? So we found some weird glitch that's happened. Your VPN doesn't work either. You might need to follow that up with the service desk. VPN doesn't work for you. So I suggest you follow up with the service desk. It used to work but stopped working. Well, that's a bit dumb, isn't it? Good morning is suggesting a reinstall. So remove it, reinstall, and maybe that might help. Right, so Wubbalub Dub Dub just said they talked to the service desk and they reset theirs. I tried turning it off and on again, log out, log in again. So yeah, so maybe log a job with the service desk. And then, so service desk is basically the IT support, which you can find through the uni. If you type in service desk, it'll take you to the self-service portal, and then you'll be able to hopefully log a job. Keep me informed. Let me know how you get on. Otherwise, I might ask IT to see if they can have a look at it if it's an issue for everyone. We've had a lot of problems recently. We're in the process of actually creating our own version of the digital slide box that's not hidden behind the paywall, so you won't need a VPN to access it, and actually have something which is a bit more open to the world. So it's not a major project in the school, but it's slowly being developed. It's been in development for the last year or two, so, but hopefully we'll try to get that resolved. Maybe by third year, when you're doing your introduction to or revision of nervous system. All right, so we need one more question. Kev's in front. I remember Kev up the top yesterday. He was, they were doing well. All right, next question. Which of the following male cells is the homologue of the theca interna cell? Ooh, this was another close one. Okay, so the majority have actually said the nurse or Sertoli cell. So the nurse or Sertoli cell is actually the homologue of the granulosa cell. So both have receptors for FSH. Both secrete a fluid. So in the form of the Sertoli cell, it secretes testicular fluid, and in the form of the ovary, it actually secretes the follicular fluid. It's the interstitial endocrine cell, Leydig cell, which has receptors for luteinizing hormone, and both produce an androgen. In the case of the Leydig cell, we know it produces testosterone, but in the case of the theca interna cell, it produces an androgen, which is then converted into estrogen by the granulosa cells in the presence of FSH. All right, with Kev still in the front, we'll go back to our PowerPoint. Let's get rid of full screen. Bring this up. All right, so we've got a couple of tricky ones. These are called lookalikes for a reason. So I'll give you a few minutes and you can have a look at these answers and we'll come back and discuss it.
2,000 years later.
All right, so I see lots of thumbs up. So the specific organ in this micrograph, what do we think? Ampulla of the uterine tube, that's a very specific answer, LeBron, and that's great because that's what we always look for, is a very specific answer. Fallopian tube, uterine tube, yes. So part B then, upon which hormone does this organ rely for normal functioning and where does this hormone come from? It is the uterine tube, my name Jeff. Relies on estrogen from ovarian follicles. Yeah. So remembering got the two cells which are found in the lining of the epithelium. Do you remember the names of the two cells that line the uterine tube? Peg cells. Yep. Everyone remembers peg cells? Ciliated column cells, yeah, that's exactly right. So we've got ciliated cells and peg cells, or non-ciliated secretory cells, and the ciliated cells rely on estrogen for the ciliation, so maintaining the cilia. So well done. And specifically, it comes from the granulosa cells. What type of epithelium lines the mucosa of this organ? We've pretty much talked about it. Yeah. Simple ciliated columnar, yes, exactly right. So it's a simple ciliated columnar. Yes, a law student's correct. And then what does this mucosa secrete? And what are the functions of those secretions? So I don't know we actually talked about this very much. Zoom protein for the sperm. So they actually basically, yeah, LeBron, that's exactly right. It produces a fluid which helps to nourish the oocyte, promote fertilization, that sort of thing. Daniel's got a question. What does FSH do in males? So FSH basically binds to the Sertoli cells and it stimulates spermatogenesis. So I said Sertoli cells, I should say nurse/Sertoli cells. Yeah, so it stimulates spermatogenesis. It stimulates the nerve cells to secrete testicular fluid, androgen binding protein, as well as inhibin and activin, depending on the levels of FSH secretion. Now, LH is responsible for binding to the interstitial endocrine cells and then stimulating secretion of testosterone. So LH binds to the interstitial endocrine cells and stimulates testosterone secretion. Can we use nurse and Sertoli interchangeably? No, you don't have to. Look, so eponyms are names which are named after anatomists, basically. And obviously, anatomy's had a bit of well, like most of science, a poor history with old white males being the only ones who are allowed to do research. And so there's been a drive recently to move away from eponymous terms. And so that's why I'm sort of introducing both terms, predominantly using the non-eponymous terms and then having the eponymous terms as well. Not many more questions to go. We're almost done. So I don't mind if you use nurse or Sertoli, that's fine. It's likely that the clinicians that you meet along the future of your career will have not been taught the non-eponymous terms, so that's why I'm also referencing the eponymous terms. Right. All right, next one. Now remember, this is a lookalike. So I'll give you a few minutes, thumbs up when you're ready.
6.5 hours later.
Okie dokie. So what do we think this organ is? It's a tricky one, this one. Seminal vesicle, question mark? Epididymis. Epididymis, there's a couple of epididymides. Seminiferous tubules. It is low power, so obviously you can't see the epithelium very clearly. So it is the seminal vesicles, okay? So the seminal vesicles are characterized by having this highly folded mucosa. It doesn't have like the muscularis like the uterine tube does, but it does have smooth muscle in the wall, but not arranged in that typical fashion that we saw before. So if we were to zoom in, we'd probably find some sperm in the lumen here, because often there's a retrograde movement of sperm as well. So upon what hormone does the organ rely for normal functioning, and where does this hormone come from? So if we know this is seminal vesicles, what is hormones responsible for its maintenance? Daniel, perfect answer. Well done. So testosterone, and it comes from the interstitial endocrine cells. Good. Yep, law student, well done. G Hill, well done. My name's Jeff, got it before as well. What type of epithelium lines the mucosa of this organ? So these are the same questions we just had for the uterine tube. Yep, simple columnar, sometimes described as pseudostratified columnar. Either is really fine, really not that worried about the specificity of that. That's great. And then lastly, what does this mucosa secrete, and what are the functions of those secretions? Whoa, Jennifer had that all ready to go. So fructose for energy, prostaglandins for motility, fibrinogen, so sperm can clot. That's exactly right. Well done, everyone. You got all those answers really, really correct. And of course, it produces the majority of the volume of semen. So about 65% or more of the volume of semen comes from the seminal. Lenifer, beg your pardon, Lenifer. I thought, yeah, yesterday it was Jennifer Lawrence. So I see it's Lenifer Lawrence today. Okay. All right. So here we've got a resin section of the testis, the seminiferous tubules, and the interstitial tissue. And so there's a number of cells labeled here. And I'll give you a few minutes to answer the questions here. So again, thumbs up when you're ready.
12 seconds later.
All right, there's lots of thumbs up. So I think a good way to start is actually to go through and identify the labeled cells, and then we can go through the questions. So what do we think cell number 1 is? Yeah, that's a spermatogonium. So the spermatogonium, the stem cells which sit on the basement membrane. So here's one. There's probably another one over here, another one here and here. So these are spermatogonium. Those are the stem cells. There's another one here too. All right, cells number 2. Primary spermatocytes, yeah, so they're the big cells with the weird looking chromatin profiles. That's exactly right. Well done, everyone. Cells number 3. So a few spermatids. Those are likely to be spermatids. So Emily and your mum's, your dad, we tend not to see the secondary spermatocytes. So they're not in the testis for very long. So it's mainly, we identify these as likely to be spermatids. Number 4. Yeah, spermatozoa, well done. So they have the very pointed, very dense, stained nuclei. The tails project out into the lumen of the seminiferous epithelium here. Good. Number 5. Here's one. Yes, well done, everyone. Nurse cells, the Sertoli cells, have that prominent nucleolus, very big nucleus. Usually, sometimes they're pointed. So there's probably another one over here. Sometimes the nucleus points towards the lumen. Good. Number 6. So we've had a few Leydig cells, a few interstitial endocrine cells, a myeloid cell. Yeah, these are actually myeloid cells. See how they're elongated? So they actually form the wall of the seminiferous epithelium or seminiferous tubules. And so these are the myeloid cells. So 7 then, 7 are the Leydig cells. So they have, you can see the little holes in their cytoplasm. That's where the lipid droplets would be. So these are the cells which secrete the testosterone. Good. All right, so then to the questions of the cells above, which would be present in the testis of a 3-year-old boy? 5, so Sertoli or nurse cells. Yep. 1, spermatogonia. Emily's got 2, primary spermatocytes. Not quite. So we only actually have primary spermatocytes when the cells are entering into meiosis 1. So meiosis doesn't begin until puberty in males, so we wouldn't find any primary spermatocytes. Emily's also got 5, so we did say the nurse cells, and 6, the myeloid cells. We'd also find the Leydig cells, 1, 5, 6, and 7. So 1, 5, 6, and 7, so it's spermatogonia, nurse cells, myeloid cells, and the Leydig cells would be found in the testis of a 3-year-old boy. So the myeloid cells are contractile cells, and so they actually contract and help to move the sperm through the lumen, because the sperm aren't motile when they first leave the testis. They only gain motility in the epididymis. So we get this periodic contraction of the myeloid cells, which helps to move the testicular fluid and the sperm through the ducts into the straight tubules and beyond. Of the cells above, which are diploid? 1, 2, 5, 6, and 7. 1, spermatogonium, absolutely diploid. 2, primary spermatocytes, absolutely diploid. 5, Sertoli cells or the nurse cells, absolutely diploid. 6, myeloid cells, absolutely diploid. And Leydig cells, also absolutely diploid. Well done. So absolutely. 1 and 2, diploid only becomes haploid after the secondary spermatocytes onwards. Well done. Which of the labeled cells above will immediately undergo spermiogenesis? Yes, well done. So the spermatids undergo spermiogenesis to become spermatozoa. So spermiogenesis is that maturational process where the round spermatid becomes the spermatozoon. And D of the cells above, which predominantly have receptors for LH. Yep, so which one were the Leydig cells? Lenifer? 7, that's right, yeah. So the Leydig cells have the receptors for luteinizing hormone. The nurse cells have receptors for follicle stimulating hormone, FSH. Good. Does anyone have any questions about that? So this is very typical sort of applied exam question that you might get. Do Leydig cells make activin or just nurse cells? I think it's predominantly nurse cells. All right, I think, let me just quickly check. That's it. We're going to finish off what makes inhibin. It's the nurse cells, which, yeah, thanks, Daniel, makes the inhibin as well. So we're going to finish off with the last 3 questions of the Kahoot, and then that'll finish us off. Oops, I think I've closed everything down. Here we go. All right, everyone got their devices ready? Last 3 questions. All right, here we go. Which part of the male reproductive tract is shown here? Oh, so another tricky one. So the efferent ductules. So you might notice that this has this very wavy appearance to the lumen. That's very typical of the efferent ductules, and it's because of the 2 main types of cells. We have principal cells and we have basal cells. And so because we've got the 2 different types of cells, it appears as this sort of waviness. So remember, the epididymis has a nice regular shaped lumen with big stereocilia. And here we don't have the stereocilia, and we've got quite a not a regular size lumen present here. So we've got this waviness, which is really classic of the efferent ductules there. What's the main function? What's the main function that happens within the efferent ductules? Who remembers? Are there any nerve fibers? There may be some nerve fibers in the connective tissue, but I don't think it's a large component. Yeah, reabsorption of fluid, that's right. So the efferent ductules resorb most of the testicular fluid. That mainly happens within the efferent ductules. Good. All right, Kev's still in the lead, quite a way in the lead. Can anyone catch him in the last 2 questions? All right, the prostate gland secretes all of the following except another challenging one. So it does secrete citric acid. If you might remember, the secretions from the prostate gland are actually acidic, and it's because of the citric acid that it's acidic. And the citric acid is an energy source for sperm. It does secrete fibrinolysin, which breaks down the fibrinogen. So it lyses the clot that's formed by the secretions of the seminal vesicles. It does secrete prostate-specific antigen, but it doesn't secrete fructose. Fructose comes from the seminal vesicles. So that's why fructose is the correct answer there. Kev's in front. Last question. In a semen analysis, which of the following would be considered a below normal value? Good, yeah. So you might remember it's about 14 to 15% normal sperm morphology is considered normal. So 10% would be subnormal sperm morphology, which most of you got. So 60 million sperm per mil is a normal value. Anything above 20 to 40 million is considered normal. 65% display forward motility. It's a very high rate of forward motility, and then pH 7.7, so it's slightly alkaline to help neutralize the acidity of the vagina. So our winner for part 2 today is Kev. Congratulations, Kev. Well done on finishing first there, followed by Luke, and then Pancreas time. All right, so that actually pretty much finishes us off. Does anyone have any questions before we finish?
Welcome to Jurassic Park.
Thank you. Unfortunately, no. Is oleogustus a thing? That's a good question. I think we're still working that out. So for those of you who may remember, oleogustus is the potential sense to taste fats. My name is Jeff. You're very welcome. Wubba-lub-dub-dub. Thank you. You're very welcome as well. Thanks very much, everyone. I hope you found this useful. Again, I'll make the recording available a little bit later. Good luck with your study week and your exams. Yeah, all the best. So I wish you guys all the best. Thanks for participating. Everyone was really great today. Your participation, it's not really worth doing this if you don't participate. So I really appreciate everyone participating. So thanks very much. Well, thanks, Emily and Dana. And have a good weekend. And thanks very much to James for stepping in and controlling the rowdy ones. Everyone was really good. Thanks very much. I really appreciate everyone coming in and asking questions and so on. So have a good weekend. Good luck with your exams, and I wish you all the best. Bye, guys.